September is Suicide Prevention and Awareness Month, and unfortunately, this is not an issue that affects adults only. In today's Mental Health Monday, we're here with Dr. Sheryl Ziegler, a psychologist and our 9 News parenting expert. Thank you for coming in. It's a sad topic to talk about. So first, new research actually linked a rise in suicide attempts for young people to something called the digital self-harm. What is that?
Yeah, this is surprising for people to understand, but digital self-harm is the online version of what self-harm is in person. So self-harm in person would be cutting yourself, burning yourself, scratching yourself. Digital means that they're going online and anonymously posting negative, horrible posts about themselves as a way to really harm themselves, but do it in a public and digital way.
How many teenagers does this affect?
This is, interestingly, looking like about 9% of
Wow.
teenagers. What's really high. So it's something that we have suspected and known about. So actually to get this research out, which is very new research, is exciting because it's validating to say, wow, there's correlations with 9% of, it is a very large study, reported digital self-harm. And then out of that group, we saw higher levels of suicidal thoughts and attempts.
That's what I was going to ask, how those two are correlated when it comes to the research and suicide attempts.
Yeah, there's some really interesting associations that came out of it. First was that, yes, the higher likelihood you have in terms of doing digital self-harm, the more likely you are to have had the thoughts and attempts. Also interesting part of it is that non-heterosexual teens in this study were much more likely to have had those suicidal thoughts. And that is also consistent with what we see in real life. And it's also parallel digitally. So really consistent findings, really concerning findings.
Digital self-harm, is that something that's new that came out of the pandemic, or is this something that's been around for a while?
Been around for a long time. I remember I did a story on this years ago, and because I actually had a client who had shared with me that they engaged in this, and so somehow we did a story, but there really wasn't the data. It was like new. But this notion's been around that I know of at least a decade. But now we've got some research and data which changes things. What
can parents do if they suspect this with their kids?
So the first thing is going to sound like something I probably always say, which is keep the lines of communication open. Maybe share that they heard about this. Talk to your kids. They need to know, kids need to know, especially teens, that parents are aware of, I heard this thing called digital self-harm. Do you know anybody who's ever done that? Have you ever thought about doing that? That's the first thing. The second thing is that when a child, any child or a teen is going to see a therapist, it should really be a part of the screening. That's one of the things that came out, is we should be asking this all the time. Have you ever engaged in digital self-harm? And the third piece is really getting to the root of what is happening. If a teenager, if somebody's wondering why would they do that, it's a cry for help. It's a way to say, I'm hurting, I'm in pain, I'm trying to see, because you put it out there and then you want to see what people comment on.
Yeah.
So really trying to get to the root of what are you crying out for help for, and then getting them the professional help that they need, resources online and offline.
And there are so many resources. And I love what you said there about keeping the lines of communication open, because I think most parents think, well, I'm just not going to talk about it and it'll go away, or they'll come to me when they want to talk about it. But really just making sure that you know that it's a fluid thing, I think is so helpful for families.
Yes, ongoing and fluid, yes.
Dr. Ziegler, thank you so much for coming in. Really appreciate it.